Today we are discussing about the mechanism of labor. Let's discuss with the definition of mechanism of labor. It is a cardinal movement that occurs on the fetal head during its passage through the maternal pelvis. Or it is a series of events that occurs on the fetal head during its passage through the maternal pelvis. It includes 9 steps. One is engagement, second is descent, third is flexion, fourth is internal rotation of the head, fifth is crowning of the head, sixth extension of the head, seventh restitution, eighth internal rotation of the shoulder, which is visible by external rotation of the head, and ninth is the lateral flexion of the spine with delivery of the fetus. At first, let's discuss about the engagement. It is the passage of fetal head, presenting part of the fetal head through the plane of the pelvic inlet. Here, during engagement, what happens is the anterior posterior diameter of the fetal head, which is suboccipito-frontal diameter, which starts from the nape of the neck to the frontal, in front of the bregma or sinciput, which is 10 cm, passes through the pelvic brim into the maternal pelvis towards the ischial spine. This is termed as engagement. During engagement, the presenting diameter of the fetal head can also be suboccipito-bregmatic, which is 9.5 cm. And at this time, the occiput lies on the iliopectineal eminence. We are discussing about left occipito-anterior. That's why I am pointing the occiput towards the left iliopectineal eminence, and sinciput lies on the sacroiliac joint. And as the head engaged, it enters the ischial spine at this phase during the time of engagement. And second step is the descent of the head, which is a continuous process. It is forward movement of the fetal head. It is dependent on the engagement. If the diameter of the fetal head is wider than the engaging diameter of the maternal pelvis, engaging transverse diameter of the maternal pelvis, the descent is impossible. But here we are discussing about normal mechanism. That's why the descent occurs as a continuous process till the delivery of the baby. The head further descends towards the pelvic cavity, towards the below the ischial spine, and third step flexion occurs. The descent is favored by frequent uterine contraction, pressure exerted by the amniotic fluid, and general fluid pressure, fetal axis pressure, at the progressive cervical dilatation, and the resistance offered by the pelvic floor muscles. After descent, at the head touches the pelvic floors, there is a resistance offered by the pelvic floor muscles and the side walls of the pelvis. It causes flexion of the head, which is where the chin is bent forward and which it touches the chest of the fetal head body. This is termed as flexion of the head. And after flexion, what happens is there is internal rotation of the head, which is an important phenomenon. Here we are discussing about the left occipito-anterior. That's why the occiput that is at the iliopectineal eminence rotate forwards underneath the symphysis pubis. This is internal rotation of the head. It occurs at the mid pelvis, and it rotates by 1/8 of the circle in left occipito-anterior, which is 45-degree angle also. But if it was if the engaging diameter was transverse diameter, it would rotate by 90th degree or 2/8 of the circle. During internal rotation of the head, there is slight twisting, torsion of the neck, because the anterior shoulder is at the oblique diameter, which is seen during the phase of engagement. It does not rotate forward. That's why only the head is rotated forward. So there is slight torsion of the neck. After the engagement, crowning occurs. Crowning is the visibility of the fetal head at the pelvic outlet. It is supported by the biparietal diameter of the fetal head. The biparietal diameter of the fetal head further stretches the vulval outlet, and the crowning of the head is occur. We can see about 3 to 5 centimeters of fetal head at the pelvic outlet during the crowning phase. And this is termed as crowning because there is no inward recession of the fetal head. Even in the absence of contractions, the head can be visible outside. After crowning, there is extension of the head where the sub-occipital frontal diameter extend the fetal head and at the pelvic outlet, and the head fetal vertex, and then the brow, and the face is delivered, and the chin touches the pelvic floor muscles. After extension of the head, slight restitution occurs, which is a visible passive movement of the fetal head, and it causes during the phase of restitution, the head rotates in its previous direction with 1/8 of the circles, and the torsion of the neck is now untwisted. And there is external rotation of the head that is followed by the internal rotation of the shoulders. The anterior shoulders that was in the oblique diameter now rotate towards the anterior posterior diameter of the pelvic outlet, and it causes external rotation of the head, which is visible outside. Then there is lateral flexion of the spine, which causes delivery of the anterior shoulder first. During normal mechanism of labor, the anterior shoulder is delivered first, and then the posterior shoulder is delivered first, second, and the body and the fetus whole fetus is delivered at the end of the labor. In this way, we completed mechanism of normal labor. Thank you.